So if you have dry eye, probably one of the most common treatment recommendations that you've heard is to do warm compresses to help your oil glands. But one of the most common comments I get, at least in my YouTube videos, is, hey, warm compresses, maybe they don't help, but sometimes they actually make my eyes feel worse, and that really is a thing. So the question is, when should we do warm compresses and when should we do cold compresses? Because if you do the wrong one, it could potentially make the condition worse. Let's focus in. So let's give you an answer right off the bat. Warm is there to treat the cause of chronic dry eye. Cold is there to treat the symptom of acute inflammation. Now this is all to treat dry eye disease. When you break it down to the simplest terms, dry eye disease is the loss of stability of your tears. You're out of homeostasis, your tears are saltier than they should be. And this is what causes what they call a vicious cycle of inflammation or a vicious cycle of dry eyes. And the most common type of dry eye or cause of this dry eye is meibomian gland dysfunction, where your oil glands aren't pumping out the oil like it needs to. And that oil is a very important part of the tear layer that keeps your tears from evaporating. And usually the people that have this type of dry eye, they'll be labeled as evaporative dry eye. Now, a lot of times in meibomian gland dysfunction, the oil in those oil glands can get stagnant, thick, almost like cold butter. It gets really hard for that oil to come out of those oil glands. And this is where the warm comes into play, where warm compresses can help with meibomian gland dysfunction. So the heat's job in the warm compresses is purely mechanical. You want to liquefy and loosen up that thickened oil within the oil glands so they can be expressed easier and replenish your tear film. And a lot of times warm compresses, routine of warm compresses is needed to help the maintenance of dry eyes. And so some people find them having to do it every day, every night, just to try and keep their eyes tip-top shape. Now, just quick tips here. The research does show which types of warm compresses are more effective. You want to have a warm compress that will retain its heat. This is at least 40 degrees Celsius or more. Not too hot to burn your eyelids. You want it to retain its heat for at least 10 minutes. Try and shoot for the 15-minute mark. If you want a list in the description, or I have videos that show you how to properly do warm compresses, I'll link them down there as well. But if you are successful in doing the warm compresses, studies do show that it can increase your tear film stability by 120% 5 minutes after you do the warm compress. Now, this is incredible because it can stabilize your tear film and reduce evaporation and hopefully help the cause of that chronic dry eye. Okay, so now this is where we get into cold compresses. Now, if warm compresses was the maintenance technique, then cold compresses would be the emergency relief technique. Cold compresses are not there to treat the MGD, the meibomian gland dysfunction. They're there to interrupt the acute response of pain, swelling, redness that is caused by the inflammation. Now, in the comments that I get, a lot of people will say, hey, you know what, warm compresses make my eyes feel worse. Cold compresses do the trick for me. Now, that person might be suffering from a lot of the inflammation and pain and redness from the dry eyes, where cold compresses will help with that, decrease that kind of flare-ups with the inflammation. And sometimes it can be tricky because you might want to still do warm compresses to treat the core issue of meibomian gland dysfunction. But sometimes those warm compresses can trigger inflammation and swelling to where you might want to alternate it with doing a cold compress afterwards. So it seems counterintuitive, but the cold compresses really can come in clutch when you're having those flare-ups of inflammation where you can feel it coming on. So who really benefits from cold compresses? I think a lot of people could use them more often in conjunction with their warm compresses, but the people that really benefit, number one, would be those people suffering from allergies or allergic conjunctivitis, where they have that itching, redness, inflammation. Cold compresses have been proven to help with that. It can be a vasoconstrictor, reduce the blood flow, and reduce the swelling over the ocular surface and ocular tissue. Number two, like I said, the acute flare-ups. There are a lot of people that might have skin conditions or other conditions that have flare-ups or inflammation flare-ups where cold compresses might work better to decrease and get rid of those flare-ups to make your eyes feel better. In fact, in this 2013 study, they found that cold compresses was just as effective as using artificial tears in treating their dry eye symptoms. So what's the best way to do a cold compress? There are some warm compresses that double up as a cold compress if you just stick it right in the freezer, place it on your eyes. Now, cold compresses, unlike warm compresses, are brief and sporadic, can be used for the acute phases of inflammation, but studies have found if you do it even as little as 30 seconds 3 times a day can be very beneficial. You don't want to go over 20 minutes though. So a way of looking at the warm versus cold compresses, instead of looking at them as rivals, you might want to look at them as companions. One to actually treat the MGD, maybe a maintenance technique that you'll do routinely, committing to a routine that can help your oil glands if you have evaporative dry eye and you've talked to your eye doctor about it, whereas cold compresses might be beneficial for those acute inflammation flare-ups, if you have swelling and you just need to calm your eyes down. They can be really helpful. But again, dry eye disease is a multifactorial disease with many different causes, many different treatments, and really it's best to go into your eye doctor to get a tailored treatment, what works best for you. But definitely check out my playlist about dry eyes. I have videos about warm compresses and other dry eye treatments in there. But also leave in the comments what works best for you. Warm compresses, cold compresses, the combo. I'd be kind of curious to hear your thoughts and if you have any questions. Stay focused.